Thank you for joining us for the 6th Annual Global Summit on Kidney Disease Innovations, Vox Populi. The time is now to prevent and cure kidney diseases. This summit is hosted by the American Association of Kidney Patients in partnership with our allies from the George Washington University School of Medicine and Health Sciences. My name is Diana Clynes, and I'm the Executive Director of AAKP. This year's Global Summit theme, Vox Populi, was purposefully and strategically chosen by AAKP for its historical meaning, Voice of the People. I am proud to help lead an organization that represents those people who have chosen to raise their voice in support of greater care choice and innovation in kidney care. And as someone who has a personal connection to kidney disease through a loved one who has since passed, I join the voices demanding a change in status quo kidney medicine. Over 850 million individuals across the world have kidney disease. This number is increasing at an estimated rate of between 5 to 7% annually. Every year, we lose thousands of innocent lives to preventable kidney disease issues and the lack of timely choice and access to treatment. AAKP believes kidney disease is both a workforce and healthcare issue. This disease takes a devastating toll on human lives and livelihoods. Most people understand that kidney disease left untreated and undetected can lead to premature death. But many are not aware that it impacts a person's dignity and ability to provide for themselves and their family. Kidney disease and outdated treatments can lead to unemployment, underemployment, disability, and dependency. In 2019, AAKP declared the next 10 years the decade of the kidney. The time is now for kidney patient consumers, healthcare professionals, researchers, industry, and all people of goodwill to unite our voices and demand change. We are optimistic we can and will save more lives, and together we can manage and solve this growing global public health crisis. The time is now for elected and appointed leaders worldwide to listen to patient voices. Governments must remove the regulatory and payment barriers they create that delay innovation and prevent timely care access. If government fails to act, we must raise our voices and demand an end to negative government determinants of health. Make no mistake, every nation is impacted by kidney disease and millions of people are at risk. The optimistic news is that every person watching can help those impacted by kidney disease and have an effect within their own nation. Through AAKP Global, we are educating patients, care partners, healthcare professionals, and policy leaders across the world on unmet patient needs. Our annual Global Summit has helped put a human face on what is now the 10th leading cause of death based on data from the World Health Organization. We have connected people across the globe in a common purpose larger than one person or nation. Together, we have increased hope and optimism. So, thank you for joining us. Your voice is the voice of the people, and you can count on AAKP to keep amplifying it throughout the world to create change. With that, I am honored to move into our final session for the day, Patients-Empowered Shared Decision-Making, by presenting on how AAKP is redefining shared decision-making. For the last couple decades, AAKP has defined shared decision-making much differently than other medical and kidney stakeholders in America and across the globe, and this slide outlines many of our core principles. We firmly believe that patients are intelligent consumers of healthcare and fully capable of making the most appropriate healthcare decision for their situation when they are fully informed of their choices. We believe that patients have the same aspirations as any other person, and we know patients expect doctors to listen and respect their wishes. That includes the desire to work full-time or part-time at a job of their choice, pursue an education, raise and support a family, own a home, and retire securely. Bottom line, shared decision-making means aligning treatments to support patients. So based off these principles, what is true patient-centered shared decision-making and why is it important? It means you care for the whole person, not just the condition. Early screening for identification and accurate diagnosis is paramount. Education on how to slow or prevent disease progression is vital. Educating the patient and any care partner on all available treatment options without any preconceived notion. And avoid making any patient or their family feel that they or their condition is burdensome to the family unit or society, or steering them into a particular treatment or no treatment based on their age or comorbidities. Bottom line here, doctors and social workers must listen and respect patients. They cannot substitute or impose their personal bias onto patients. Additionally, AAKP believes that patient-centered shared decision-making must include aspects that matter most to patients, their families, when treatments are discussed. And these are the areas that are often left out of existing shared decision-making discussions and tools. And they include cultural and spiritual beliefs, and the patient's role within the family unit and or society. So just as importantly as what true patient-centered shared decision-making is what it is not. And that is an environment where government-directed mandatory requirements exist to discuss end-of-life care, where third parties like insurers interfere in the doctor-patient relationship, and where coercive efforts exist that make patients feel they need to end life-saving treatments. This is why AAKP set out to develop our own shared decision-making tool that encompasses all of AAKP's principles, takes into consideration all the elements that holistically make a person who they are and influences how and why they make treatment choices, and eliminates the pessimistic national and global narratives away from labeling kidney patients as unwise, burdensome, or too costly. Some highlights of our development process included conducting a landscape assessment with our partners from Engage to Advocate, which found most shared decision-making tools that currently exist are too narrow and focus too heavily on merely the clinical aspect of treatment choice. This is, of course, an important factor, but only one of several patients actually take into consideration when making healthcare decisions. And with that, I should say, AAKP discovered the need for a holistic shared decision-making tool that takes into account more qualitative measures and attributes that are historically more difficult to measure, but lend themselves to supporting an individual's aspirations, responsibilities, and overall quality of life as they define it. And in a future phase of this effort, we are excited about eventually taking the tool global by translating it into other languages and tailoring it for optimal reach. Upon launch, our shared decision-making tool will be available in print and digital formats. Now I'd like to move into the next portion of our session where we've invited two individuals to give their perspectives as kidney patients on shared decision-making and what is important to them. First, I'd like to introduce Ms. Molly Boll. Molly is a staunch patient advocate and research participant. She has 35 years of business experience and has served as a marketing manager, a vice president of marketing for a seafood processing firm with revenues of over $75 million. As a person living with diabetic kidney disease, she's dedicated to educating others about diabetes and their right to choice and access to treatment options that support their overall health, well-being, and aspirations. Molly, thank you so much for joining us. Like AAKP, I know this topic is very important to you.
Thank you, Diana, for having me today.
To begin our Q&A, Molly, AAKP believes the medical community, including some researchers, often view kidney patients from the narrow lens of serious illness and the perceived burdens of various treatments. In terms of shared decision-making, can you tell us why medical teams must consider all aspects of life that are important to patients, including aspirations like continuing full-time or part-time work and their chosen career path, pursuing an education, working to build a secure retirement, and the value patients place on time with family and interests like travel or hobbies?
First of all, I'd like to comment that human beings are made up of more than just a body. We are made by our creator or a higher being, consisting of a body, a mind, and a spirit. Patients have to be treated in respect to their lifestyles, and every patient is different. Some patients come from different backgrounds, so they have different lifestyles, and it's essential that a patient not be focused just on their disease. They have a life to live. Their disease is just one aspect of their life. When those people that get diseases center on their disease, they tend not to do so well. When they're focused on looking at how to keep living with their diseases and focus on their life, they do tend to do better. They also need to work with their doctors to have a special relationship building with their doctors, and that requires a lot of communication skills. And every human being is different. It requires a lot of work by the doctors to have skills, good communication skills and insights to their patients. Some doctors are lacking in this area because the doctors are more scientifically oriented and want to get their protocols forward and used, but there's no one size fits alls because every human being is so different. It requires a lot of work to really get a good shared decision making process going. And the problem in today's medical society is that we have constrictions by our insurance companies. I know I only get 10, 15-minute appointments with Medicare, which is very pragmatic when I personally have so many comorbidities. My particular doctor says I need more than 3 appointments to go over everything. So that's a problem. So it's so important to address all the interest of the patients, their lifestyles, their hobbies, what they're interested in, to to match up the treatment so that they can continue doing what makes them happy, because that's going to help them with their disease in the long run.
In Mali, AAKP also believes that all patients should be treated equally, with full respect and the understanding that when fully informed of their care options, patients and doctors they trust can together make wise decisions about treatment plans. Can you tell us why shared decision making should be patient focused and free of any bias among medical professionals toward a patient's perceived socioeconomic status, ethnicity, or other factors, including age? And can you tell us why there should also be full respect extended for a patient's spiritual and cultural beliefs?
Patients, when they go to their doctors, at least as far as I'm concerned, most patients pick up right away when a doctor's biased towards them, because patients are quite sensitive. First of all, when they have a disease or they come to the appointment, their sensitivity is very pronounced because of just the setting of going to a doctor. So they're bound to pick up on that bias quite a bit. So the doctors have to be very cautious about that, and it would wreck the relationship building. Um, Communication skills are again, they're paramount in doctor-patient relationships. Uh, Not only to the outcomes of the healthcare for the patient, but into how the doctor approaches the patient. But, you know, if you get a good doctor, that's half the battle of getting good health care. And so many people think it's just, it's a doctor can have the greatest skills in the world, but will not be effective if they don't have the trust. There's a key word, the trust and the faith of the patient. If the patient can't trust the doctor, it's not going to work out. So that being said, when they pick up on any bias, it's a very negativity for the patient. And going into the idea that the doctor has to respect the spirituality and the cultural um, aspirations and ideologies of the patient is again paramount, because I brought up at the beginning how all human beings are made up of body, mind, and spirit. And God does not create junk. God creates beautiful, beautiful human beings. And doctors have got to respect their patients as beautiful human beings. And also, they've been proven in studies and science that the spirit can have a key role in the ability of patients to achieve cures on diseases. Some patients live longer than others, and wonder why that is. Well, I'll give you an example. You're looking at a lady right now. I have many comorbidities, heart disease, kidney failure, type 2 diabetes, over 40 years, type 2 diabetic, insulin dependent, and I have a whole bunch of majors and a whole bunch of minors. I can't walk. I'm disabled, no knees, no hips, and no spine left. But guess what? I take all these lemons I got and I make lemonade, and I got lemonade stands all the way to the mountains from Seattle. It's all a matter of your drive and your spirituality. And so what I do is I have my projects, and my projects are I go around and help people, and I have major projects now around the entire United States with over 115 Catholic radio stations. They're broadcasting my spots all around 20 states in the nation to get people to pray for our nation, our communities, and our families during these trying times. So I reach out, and so doing, I forget self. So here's a motto for all kidney patients again. Look outward, not inward. When you look outward, you forget self. When you forget self, and something inside you, your endorphins forget self, and you seem to get better. So that's what I do, and so that's involved with mind, body, and spirit. So we all those things work together to help your health go forward. And it can have a major effect on your outcome for your health care.
And final question, Molly. You have been an energetic and passionate patient advocate. You have inspired fellow patients to have the confidence and courage to demand the best treatments that align to their needs. What advice do you have for patients that feel their medical professionals do not respect their dreams and aspirations and are not engaged in patient-centered shared decision-making? Should they find another medical team?
I don't think right off the bat they should go run out and look for another doctor. I say work with your current doctor. A lot of doctors are not even aware of this shared decision-making process. And you see a lot of doctors, they don't have good communication skills. They're boom, 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 because they have relegations of, time limits, as I discussed before, from insurance companies, etc. So it might be a good idea for you to collect some information about shared decision making. Find some information, run off a couple copies of a couple pages on the subject. For your next meeting, make an appointment with a doctor and go in there with some educational materials to leave off with the doctor. Be up front with the doctor. Tell them you want to discuss shared decision making with them, and hand them the copies of the educational material and ask him to read it. And then ask him if you can have a follow-up appointment to discuss it after he's read it. And then you can talk about it and tell him what your ideas are that you'd like to become involved with the shared decision making discussion with him about your future healthcare program. If he's willing to go forward, you have a beginning basis for discussion. If he's not willing to do that, you've at least been upfront with him. And then I think it's time for you to think about finding another doctor. But if you, in your research, you should address the questions of your potential new doctor if they're willing to work in that direction with shared decision making. And if they're not, I wouldn't go forward with a new doctor unless you found one that was willing. Because the more a patient studies shared decision making, at least from my perspective, the more they'll buy into shared decision making, because I believe it's a hot topic today, and I believe it will do wonders for not only for patient doctor relationships, but it will do wonders in the long term for the healthcare effectiveness for the patient's health and longevity and happiness. Because in the long run, patient-centered decision making will allow patients, if when they live their lives the way they want to, even though they have a disease that they're living with, it doesn't define them as a human being. It's just something they live with. They're able to cope with it. And my philosophy is that they have the disease. And the idea is, as I told you before, in summary of all this, is to continue on living not inwardly, but forward thinking. Keep living your lives to the best of your ability, but go forward and keep on smiling until you get to those pearly gates of heaven. But, live your life with joy, do what makes you happy, and, dance with joy.
Thank you, Molly. It's always wonderful to have you joining us. Our next patient speaker is Mr. Dean Armandroff, a current dialysis patient and AAKP ambassador. Professionally, his career has spanned several decades of service in national public policy and medical affairs, including working for the American Medical Association as a regional political director, where he oversaw their political action committee and engaged with a broad bipartisan coalition of lawmakers with shared concerns for the integrity of the doctor-patient relationship, patient care choice, and policies that support timely access and payment for new medical innovations. Dean, we are so pleased to have you join us to answer a few questions.
Diana, thank you. Thank you for having me at this year's Global Summit. It's great to be able to participate. And I really want to thank everyone who's participating, because I think this is going to be a great resource for kidney patients around the world.
To get started, AAKP believes the medical community, including some researchers, often view kidney patients as being all the same. They may view them simply in terms of having a serious illness and not take the time to get to know the person as a whole. Can you tell us how, as a patient, you approached your diagnosis and how you have engaged your medical team to let them know who you are and why your choice of treatment matters to you, your family, and your career?
Well, first of all, the most important thing in this whole discussion are really two factors. One is every life matters, every patient matters. And secondly, everybody's different. There's not a one-size-fits-all solution. So as that affected me, I just made sure I made it clear where I was coming from. I did as much talking as listening. I told them about my family, told them I have a 9-year-old son, So being active, having energy, being able to participate in family activities was very important to me. I also have a career and wanted to keep working. I know some folks might choose to work part-time or retire, but I really wanted to keep working, felt I still had a lot to give in that area. And so we tried to work the treatment around that fact. The one thing that is a problem is, of course, there aren't a huge number of options. You have at home dialysis, either PD or hemo or in center. And unfortunately, neither of those options are that great for fully living your life. But I've explained what I wanted, and by pushing, I was able to get more or less what I wanted going, for example, earlier in the morning. So I'd still have most of the day available, both for work and family stuff, only using 2 weekdays, Tuesday and Thursday, so that I had less time away from work. And so I recommend to all the patients to speak up, to let them know what you're all about, to list out your priorities, and don't just have the care dictated to you. Be an active participant.
In understanding that, AAKP also believes that all patients should be treated equally with full respect, and with an understanding that when fully informed of their care options, patients and the doctors they trust can together make wise decisions about their treatment. Since you have a long career in medical and policy issues, can you tell us why shared decision-making should be patient-focused and free of any bias among medical professionals toward a patient's perceived socioeconomic status, ethnicity, or other factors, including age?
Well, the first part of that is that it should be, as you said, patient-centric. This isn't about the insurance companies, it isn't about the providers, it isn't about the money. It's about the patients and what the patients want and what their family and caregivers want. As long as that's kept front and center, things will be okay. There are many instances where people don't have full information. There's a language barrier, a cultural barrier. Maybe they're so overwhelmed by the diagnosis and all the things they have to do that they can't be a full partner. And then it falls onto the physicians, the social workers, the caregivers to make sure that that voice is being heard. There's no excuse for the patient voice not to be heard or for it not to be patient-centric. And those excuses are, insurance or lack of insurance, ethnicity, race, cultural divisions. None of those things should matter. It should matter what's important to the patient. When I have done advocacy in the past, I've always tried to tell people stories. I've always tried to put the stories of people and their real lives first, rather than the numbers or the budget or the policy issue. And as long as you do that when you're making these decisions too, I think things will be good. One of the things I really love about AAKP is that focus on the patient. Independent organization, not controlled by providers, not controlled by physicians. And it's also something that is all about the patients, and that's what we want.
Thank you, Dean. And let's take your response a step further. Can you tell us why there should also be full respect extended for a person's spiritual and cultural beliefs?
Well, if we're talking about caring for the whole person, not just looking at them as a disease or as a insurance line item number, then you have to look at the culture, the family, spirituality. These are all part of that whole person that we're talking about. And so, for example, I think that the faith of a lot of people really drives their decision making. So if the physician is dismissive of that or doesn't take it into account, then they're not going to be treating that whole person. I know from my work previously, working with the American Medical Association, that cultural distinctions are really important. For example, in the Asian community, someone might defer to the oldest person in the room. Apparently that's part of the culture in some Asian societies. If you're not aware of that as the provider, you might literally be talking to the wrong person in the room. And so these cultural touchstones and faith touchstones are really important and cannot be diminished. And I think in medical education, in the work of the social workers, et cetera, they need to be aware of that, importance of that.
Just a couple more questions, Dean. We know how you are a longtime advocate for principle-based policies that are people-centered. Based on your experience as a kidney patient on dialysis waiting for a transplant, what advice do you have for fellow patients if they feel their medical team is not listening or respectful of their dreams or aspirations? Should they or their care partners find other medical team?
Well, first of all, the short answer is don't give up. Keep talking. Keep expressing what you want, even if you think they're not listening. Always leave the door open to changing providers. I know in the dialysis world it's difficult because you're tied into a certain center, sometimes tied into a company, but you can change. If you get a different nephrologist, they'll maybe send you to a different center, a different company where there might be more responsiveness. The other thing is you can pick out the techs you want and the nurses you want. So if you've had a bad experience with a certain tech, don't worry about them being offended. Don't worry about rocking the boat. The number one priority has to be your own care and your own satisfaction as a patient. So speak up, take action, and don't let yourself be on the receiving end of the care. You need to be driving that care. And if you don't know what to do, if you're feeling overwhelmed by it, get someone to help you. Talk to the social worker in the dialysis center. They generally are very helpful. Or turn to AAKP for resources, because I think there's a lot of resources that we can provide to give you guidance on how to talk, what questions to ask, how to do it. The help is out there. So don't just sit back and kind of shrug your shoulders, but take action.
And final question, Dean. Based on your kidney journey thus far and your treatment, are there any additional insights you'd like to share with our audience today?
Yeah, I think the doctor-patient relationship is really a constant work in progress. You know, in my experience with dialysis, I've been doing it for a few months now, since December of last year, and I'm still trying to get them to tweak things, to get my target weight right, to get the amount they're taking out each time right. And you can't give up. You got to just keep working on that relationship to get it the way you want it. So I know this is a lot. I know that people think, oh my God, there's so much going on. I need to know so many things. Help is out there. There are resources you can use, and you can do this, because if you will have a much worse outcome if you're not actively involved in your care.
Thank you, Dean, and thank you again, Molly. We appreciate your time and candid responses on this important topic.